Hello, I'm Liz Tassone. I'm with the Caregivers Assistance Network, and I'm here today with Dr. Kathy Rosenbaum. And Dr. Kathy is a Christian holistic clinical pharmacist, and I'll first let her explain what that is, and then we'll talk a little bit about polypharmacy, which is another word for saying many, many drugs, which is what a lot of caregivers deal with in terms of their loved one who may be on a lot of different drugs from a lot of different doctors. So we're going to talk a little bit about that. So first, welcome, Kathy.
Thanks, Liz. It's a pleasure to be here with you.
Okay, first just explain what your title is here as a Christian holistic clinical pharmacist.
Well, holistic means I look at mind, body, spirit in terms of patient care, not just the body or the physical. Clinical means it's all based on evidence, that is, any recommendations that we talk about for removing or trying to cut back on, if you will, prescription meds, or kind of consolidate the whole health regimen, is based on evidence, and that means I have to know how to interpret research and literature. And people know what a pharmacist is. I'm gifted in looking at medicines and looking at disease states, and of course, Christian, I serve Jesus Christ.
Okay. And your PhD is in pharmacy, is that correct?
It's actually a PharmD, and it's called Doctor of Pharmacy, and you're right.
Okay. Okay. Very good. Well, what we wanted to talk about first today is the fact that a lot of older adults are getting prescriptions from a lot of different sources. And so how might a caregiver approach this with their loved one in terms of how might they know what they're on, and then who do they talk to about that, and so on?
Well, typically individual prescriptions these days come with little leaflets, and there are patient identifiers on those leaflets, and we hope that our clients or patients, if you will, are keeping those with them. So a caregiver can start by looking for those leaflets. Oftentimes patients are being advised to write down their list of medications. There may be a little pocket folder or record of the meds, and by the way, over-the-counters are included in those records, as well as dietary supplements, because all of them, in my humble opinion, act like medicines, and they interact, they have side effects, they need to be managed. So a good patient-physician relationship encourages that. Sometimes patients will shop at different pharmacies. Is that a problem? I think so. We have to watch out for that. So it might be a little bit harder for some caregivers to find out all of the information at first blush, but in time, typically a patient can share with the individual where they're shopping for their scripts.
Okay, so you're saying hold on to those little, in my case, it's like a little white thing that comes with the drug. Hold on to those.
The patient education leaflets.
Okay, put them in one folder maybe, and so that you have them all in one place?
That'd be really smart.
Okay, and then is that something that the caregiver would bring to the doctor with their loved one, and so they can say, here's all the drugs that they currently have?
If that would be a great way to start, I'm all in favor of that. Somehow or other we have to keep a tidy list of all of the individual supplements, over-the-counters, and prescriptions in one consolidated place. And there isn't one right answer. There are a lot of ways. The leaflets are a great place to start.
Okay. And then over-the-counters include Tylenol, aspirin, sleep aids that somebody may be taking. Can you think of a few others that, or even like a decongestant or something like that, correct?
Absolutely, and some individuals might be taking over-the-counters for heartburn or for acid
like
reflux.
Like a Prilosec, one of those type of drugs, or are there others that I'm not, like a Tums? Would you say that's?
Both are great examples.
Okay, okay. So even those things that they've just kind of decided, hey, I have heartburn, I'm going to start taking Tums, that needs to be part of the profile that you're saying we need to set up, and so that the family member can bring this to the physician and know.
Absolutely. And that's a great value add for caregivers, by the way, so they feel like they're really a part of the team.
Okay, good. And what about things like alcohol, or knowing how much alcohol somebody is consuming? Maybe they're doing a daily drink. Is that something the physician is going to ask about or needs to know in terms of these drug interactions?
I'm going to guess that physicians will not query for that, and yes, it is a very important piece of information, and I'm really pleased that you asked about it. Alcohol can interact with cough and cold syrups, which they themselves have oftentimes alcohol bases. Alcohol may also interact with such prescription medicines as Coumadin, which is a blood thinner for individuals who may have a heart condition, such as AFib, or a clot in their leg, which is called deep venous thrombosis.
Okay. And in addition to that, aren't there a lot of people that take vitamins that they hear about, or so-and-so's taken, so they've got like a cupboard full of different vitamins? Is that something that the physician needs to know and that can be part of that folder as well? Supplements and...
Supplements in general, yes, are very important to share. In other words, the more information a caregiver can provide in a visit with regard to accurate lists of supplements, over-the-counters, and of course, once again, the prescription meds, the better conversation and the better, honestly, the decisions are going to be made for that loved one. Why do I say that? Well, you know what? There are some interactions between vitamins, believe it or not, and such prescription medicines as the statins like Zocor, Mevacor, Crestor, that make those products not work as well in lowering cholesterol. And there was actually a study done by Brown et al. A number of years ago that looked at individuals who had heart disease, high cholesterol, and they were randomized into 4 different treatment arms. And believe it or not, the treatment arm where individuals took prescription cholesterol-lowering medicines and vitamins that acted like antioxidants actually had worsened cholesterol. That is, it went up instead of down.
Wow.
And their heart disease worsened. So the take-home message there is it's important to look at the whole picture, and hopefully our pharmacists are in a good position to do that for our loved ones as well as our caregivers.
Okay, and I just wanted to say one thing about compliance on these drugs. A lot of times people will cut the pills in order to save money. And what do you have a stance on that as a pharmacist in terms of compliance?
I think that compliance or adherence is one of our #1 problems in terms of patient care. That should be negotiated. That is, talk to the pharmacist at the point of tendering that prescription. Find out if that product should even be cut. Some of them should not. And I'm going to include patches or topical products as well as the pills. If it's an extended release product, you shan't cut it because it renders the product ineffective. So negotiate at the time of sale with the pharmacist, can we cut this in half to save money? Or can we find another generic form? Or can we take this every other day, doctor? Or can I stop this for a few weeks and come back on it in the case of perhaps such medicines as ulcer treatment or heartburn treatment, or even medicines to treat osteoporosis?
Very good advice. So thank you, Dr. Kathy. Thank you for being here. So this is important information, and there'll be a link to Dr. Kathy's website if you would like more information above this podcast, so you can check that out. I want to thank our sponsors, who are Landfair Retirement, Hillebrand Home Health, Blackstone Healthcare, Family Bridges Home Care, Independent U, and VITAS Hospice. I'm Liz Tassone, and always remember that caring matters.